So here's the scenario. Your ear starts to hurt, and it's bothering you on Thursday, and it's a little worse Thursday night, but you just know it's going to get better. And Friday, well, you've got a lot of things going, so ignore it. By the time Friday night rolls around, you are in extreme pain. The doctor's office is closed, and you have to go to the emergency room. Now, that trip to the emergency room may really mean a lot of out-of-pocket expense. In fact, emergency rooms can go anywhere from $150 to thousands of dollars just to cover the expense of what had to happen in an emergency care situation. So what does this have to do with what I'm going to talk about? What I'm going to talk about is health insurance. Health insurance is something that was originally set up to help people when they come into a situation where they have a great expense or even a catastrophic illness where they are not going to be able to pay those normal medical bills. Now, in order to get health insurance, you need to pay something like it's called a premium. A premium is a set amount of money that you pay every month to receive a certain amount of health coverage in exchange for protection against the large medical bills. Now, there's a couple of kinds of health insurance that are available. One is called a fee-for-service plan. That's the traditional insurance plan where the patient pays a premium, but then they have to pay a deductible. And different policies carry different deductibles. So you might have to pay a $20 deductible, and then they carry the rest of the cost. You may have to pay a $50, $100. It's whatever the plan is set up. But these are some terms I want you to become familiar with: the premium and the deductible. Now, there's something called a managed care plan. This is where there's an insurance company that has a contract with a group of doctors. Okay? Now, in that, usually there's a lower cost for the patients because of this arrangement. But there's also something called a copayment. And a copayment means that before the insurance group is going to pay for the amount of services, that you have to pay a copayment, and that's a set amount as well. You pay the copayment, and that's each time for a medical visit, and then the insurance will pick up the remainder of it. Now, the pro is that it's a little less expensive. The con is that you only have a certain amount of doctors that have agreed to do this plan. So you're limited in your choice of doctors. All right? Now, the third kind of medical care is a government-assisted care, and that has two kinds of plans. One is Medicare. Medicare is a program that was set up originally for people that were 65 years and older. And they will cover healthcare costs for this group. Also includes those that are developmentally or disabled in some way. They can receive Medicare benefits. Medicaid is a healthcare program for a certain amount of individuals. Those on welfare, those that have a lower income, those that have dependent children, again, some that are 65 years or older, and those that are blind or disabled. And to be eligible, you need to work through a person who has the job of finding out which is the best program for you. So these are things that you need to know as you embark upon your career of knowing how to be covered on healthcare, and it's just good to be informed.